we have seen a pretty consistent increase in the risk of suicide mortality in both Utah and the US in general. And despite the concerted effort that's been made to stem these rising rates, we continue to see rates rise. So that really does suggest that we need to consider a broad range of contributors, including environmental contributors. I'm particularly interested in trying to better understand the risk factors for suicide in this proximal period. So this is the period just prior to suicide death, like the 2 weeks, that are really a critical period during which to intervene to prevent suicide risk. Our most recently published study, we considered suicide deaths throughout Utah. And we were also interested not only in what was happening year-round, but also by season. Historically, we've seen peak suicide rates and suicide risk in the late spring to early summer. We found an independent relationship between heat and suicide year-round. Increasing heat is associated with suicide risk, but that effect is amplified in the presence of air pollutants. Nitrogen dioxide and suicide risk, that relationship was present during the cold season. We currently work with the Zero Suicide program here at the University of Utah, and we have proposed plans to the National Institutes of Health to provide funding that will help us to translate our epidemiological findings into interventions for suicide. I don't know anyone who hasn't been directly impacted by suicide. That's why I do think this work is incredibly important. We're really fortunate here in Utah to have historically legislative support. I think there is absolute awareness for the fact that Utah has among the highest age-adjusted suicide rates in the nation. And that is translated into legislative support and public support, because our work would not be possible otherwise.